All right, listen, the next story, again, this is
possible.
one of those stories that you think to yourself just when you thought it was safe, and now forget about, don't forget about, but I mean, we know we're dealing with COVID, we know we're dealing with flu, RSV seems to have kind of worked its way down a little bit, but now all of a sudden strep. Now, I should point out, strep is nothing new, right?
No.
Strep's been around for the longest time, but it's the fact now that some of what's happening, strep infections are becoming extremely serious, especially for kids, to the point where we've actually had some deaths from this
Quite
now.
a few, sadly. Yeah.
So Chris Labos, cardiologist with a degree in epidemiology, who you can hear, by the way, Sunday mornings at 8:10 here on CJAD, is on the line now. So Dr. Labos, let's start with the fact that, as I said, strep, nothing new. Why have we seen this deadly turn, or how? What's happening?
Right. So here's the thing. As you correctly pointed out, strep infections cause strep throat are usually mild, but there are forms of invasive streptococcus infections where the infection just becomes more severe. It enters into the bloodstream. It goes deep into the tissues. And so it can cause things like necrotizing fasciitis or scarlet fever or toxic shock syndrome or even meningitis. We tend not to see these things as much as we once did, earlier in the 20th century, because in the post-antibiotic era, most bacterial infections can be treated and controlled fairly easily. It's just that for the past couple of years, there have been more strep infections out there. And when you have more strep infections, just numerically, you will end up seeing more severe cases. And that's why there have been more severe strep infections, not just in Canada, but actually around the world.
But what's going wrong here where it gets to a point where it's deadly? That's what's kind of blowing my mind in this. You would think you would be able to identify, okay, this is what's happening. Let's treat it. Let's make sure everybody's okay.
Well, yeah, so there's a couple of things that are going on here. So first of all, right now, you do tend to see more strep infections in the winter, so it's not surprising that there would have been more cases in the past couple of months because this is when strep circulates like all other infections. The other thing, though, is that a lot of strep infections are what are called secondary infections. So you get a viral infection first, and then you get a secondary bacterial infection afterwards. And you used to see this a lot with chickenpox. Kids would get chickenpox, and then they would get secondary strep infections after that when the strep would infect the open wounds from the chickenpox sores. We don't see as much chickenpox anymore because we have a vaccine now, obviously. But you would also see strep after cases of influenza, because it would irritate the lining of the airways, and so you would get a secondary strep throat as a consequence of that. So now you have not just a lot of circulating influenza, but also a lot of circulating RSV, a lot of circulating COVID. And so all of those things together has meant that for the past couple of years, there have been more outbreaks of strep, and that's why the numbers are higher now than they were pre-pandemic. Add on to all of that the fact that it's harder for people to access the healthcare system. A lot of people don't have a family doctor. A lot of people don't know where to go when they get sick. And so what was once fairly straightforward, you go, you get a throat swab, you find out if somebody has strep, you treat them with antibiotics. Now, one assumes that to some degree, a lot of these infections are being diagnosed later, and that is increasing the risk that some of them are progressing to more severe forms.
Okay, can I ask, and so if you're a parent, because we're talking about children here, becoming especially severe strep for them, what are symptoms you should be looking out for here?
So strep throat typically is a very severe sore throat, very high fever, the throat inside, if you were to look in the mouth, very red and inflamed. Typically, you see sort of white patches on the throat if you're able to look in the mouth and see them. But it's very hard to differentiate strep throat from other viral symptoms. Now, if your child also has a runny nose, nasal congestion, typical viral syndromes, then it's less likely to be strep. Strep throat classically would typically be a sore throat, but none of the sort of nasal congestion, runny nose type symptoms that would go along with sort of a regular cold, as it were.
My understanding is that it also, everything happens really quickly. Once it gets to a dangerous point, there's kind of almost no turning back, it seems.
Yeah, it can be, and there are certainly severe cases, to be sure.
I don't mean to sound dramatic. I sounded a bit dramatic there, but I was seeing that people were being hospitalized, and then it was all happening very quickly.
Well, and it can, right? And if you think back to cases of necrotizing fasciitis, flesh-eating disease, that progresses very quickly. Now, again, most people who get a strep infection, even if it's a skin infection, it will remain superficial. They will not get a deep infection. And so it's very hard to predict who's going to get a severe form of this or not. In general, the usual things apply. If you're at the extremes of age, if you have pre-existing medical problems, you're obviously going to be at higher risk for a more severe course. But some people, just for genetics or unclear reasons, they tend to have more severe disease than others. And this is a very sort of hard thing to predict. The one thing that is under your control, though, is that if you can start antibiotic therapy early, it's much less likely that it will progress to a more severe form because you are actually treating the infection. That is the one advantage of bacterial infections over viral infections. We can treat them much more easily with antibiotics that will essentially wipe them out.
I want to ask, we're out of time, Chris. I just want to ask one last thing, and that is just if your child develops just a sore throat in and of itself, that is not reason to end up going to a hospital.
No, and I mean, but if they were in a daycare where there were other strep infections, then that's at least a reason to go get a swab for strep throat, and you can actually book those on Click Santé. There's a special button where you can organize those.
All right, there you go.
And you go to the hospital when it's persisting and there's a fever and runny nose, a bunch of the symptoms.
If things are getting worse rather than getting better, then that's a sign that it's probably a more severe infection, and you probably do want to then seek medical care.
Dr. Chris Labos, you can hear him every Sunday morning, 8:10 here on CJAD 800. Chris, thanks so much. Appreciate it.
My pleasure.